Right, now that we've gone through all of the tissues, I want to take a couple of videos and talk about how tissues heal. Really, our last two learning targets within this unit. Okay, so the first thing that we need to know about is this thing called the inflammatory response. And if you think of inflammatory response, it's just inflammation. If you've ever had something swell, you sprained your ankle and it swelled, or you got an infection and it got puffy and swelled, that's called inflammation. A lot of people think that it's a bad thing, but it's actually a really good thing. Okay, to a point. So you can see there the things that it does: allows the body to defend itself. It isolates that area and make sure that any microorganisms or infections aren't getting to different areas of the body. Removes damaged cells and allows tissue repair to happen. So there are five things that happens during the inflammatory response. Number one, it gets red. You guys have all seen that. Something is swollen, you see it get red. You also see that it's producing heat. If you've ever felt something that's swollen, it feels warm. Three, it swells. Four, it probably hurts a little bit. There's pain receptors there that are being put under increased pressure because of the swelling, so it hurts. And then you probably can't use that area of your body as well. So, for example, if I sprain an ankle, well, I've lost the mobility in that ankle because of the swelling. So those things are happening all during inflammation, and they're all really a good thing. Now, these things happen because, or all of these processes happen because of something we call chemical mediators. Okay. They basically are these chemicals, hence the name, that are going to um, cause these reactions in the body. So there's a few that we need to know. So before we get to those, sorry, that's my fault. What do the chemical mediators do? Okay, the first thing that they do is they induce dilation of blood vessels. What does dilation mean? Think if you've ever heard of somebody dilate their pupils, their pupils get really, really big. So we're going to dilate the blood vessels and make them bigger. And what that does is it allows the blood to travel there faster. That's a process called vasodilation. Okay, so the blood's going to travel to that area faster. And because of that, we're going to bring things like white blood cells and other substances or materials that we need to fight that infection. Chemical mediators produce that redness and heat that we discussed a moment ago. They stimulate the pain receptors. We want pain. Pain, I know nobody likes to be in pain, but pain is a signal that tells our body that something is wrong. So chemical mediators are helping us do that. And they increase permeability of blood vessels. Now, what do I mean by that? Well, when we increase the permeability of blood vessels, it allows stuff to go into and out of the blood vessels easier. That's not necessarily blood, like the plasma is not going to leak out of your blood vessels into that area, although it can. But we're talking about diffusion of substances through those blood vessels that um, allow those things to get to the injured area. Okay, so those are the jobs that the chemical mediators do. So what are the types of chemical mediators? What are the things? So we're going to see a lot of weird words here. So bear with me. First one is histamine. Remember, these are produced by the mast cells that we talked about earlier in the unit. This allows the dilation of blood vessels and reacts to the injury and allergic. That's going to be with the inflammation. Number two, we have these things called kinins. Those things stimulate the pain receptors and help with the permeability of blood vessels. Number three, prostaglandins. These things promote inflammation. You're going to see a lot of these things do basically the same thing. And I should tell you that we are really just scratching the surface with the function of these things. Okay, we could go really, really in depth with all of these. We're not for this class. Leukotrienes, again, another one of these things that are helping to promote inflammation. When I say promote inflammation, they are causing and creating that inflammation, which is what we want. Now, with all this process, there's this thing called edema. So we've talked about inflammation a lot. Okay. Well, when an area swells, it swells because water is moving into that tissue. Okay, and you see that word osmosis, right? You guys talked about that during biology. Well, water is moving into that area, and because water is moving into that area, it is basically putting pressure on that whole area, whether it's a joint or an area where you got a cut or something like that. And because of that pressure, it's causing a lot more limitation of movement, and it's causing pain in that area. And again, this is a good thing. That's a signal. It tells us, hey, wait a second, something's wrong. I can feel a lot of pain, and I can feel that I can't use that area as well, so I better not use it. So that's a signal to our brain saying, take it easy on that injured area. Then we have these things called clotting factors. Clotting factors, if there is a damaged blood vessel, it's going to run there and it's going to clot that blood vessel and make sure that it's not bleeding out, right? We want to clot that blood vessel, just like you would get a scab on the outside of the skin. You'd get the same thing with these clotting factors on your blood vessels on the inside part of your body. Now, all that's a good thing. Inflammation is a good thing, but sometimes to a point we don't want a bunch of inflammation. Maybe you've probably had a swollen ankle or something, and you've been told to ice it so the swelling goes down. Okay, so after a time, we don't want that swelling to just stay there and accumulate in our joints over an extended period of time. Or we may just be in pain and we want to cut out that pain. So, what do we do to inhibit that inflammatory response? Well, antihistamine. We've talked about this with allergic responses. They also can do the same thing with inflammatory responses and stopping the effects of that inflammation because of the histamine. Aspirin, okay, just a drug, right? That will prevent the production of those prostaglandins, which up here, remember we said it promotes inflammation and the pain, so that's helping with the pain and the inflammation. And then cortisone. If you've ever gotten a cortisone shot, I know that a lot of athletes will get shots if they've got a bad knee or something. I actually had a cortisone shot in the back of my neck because of a herniated disc. Okay, so cortisone basically reduces the release of these chemical mediators and slows down that response. Okay, now again, let me repeat, these are all good things. Inflammatory response is a good thing to a point, but we don't want it to inhibit our movement, inhibit our function, and cause us pain for an extended period of time. And that is the inflammatory response.